We're all familiar with that feeling when you've tried everything to fix nagging pain in your joints and absolutely nothing works. You followed the advice, you did your stretches, you rested, they told you to try a new diet, but that one nagging joint still won't quit. It's the constant dull ache, or sometimes a sharp jab that just shows up out of nowhere. You thought you were doing everything right, and yet you're still not getting the relief you're looking for. You end up feeling stuck in a loop that you can't seem to break, and that's when you start questioning the old playbook and you start searching for something new. Hopefully something that will help your body actually repair instead of just covering up the pain. That's where I found myself, and that's what led me to red light therapy. Now the question is, does it actually work for joint pain? Let's find out. So in this video, I'll break down the surprising science behind red light therapy specifically for joint pain, what a lot of the clinical research actually says, and then something that they do differently, which might be the reason why your joint pain won't go away. And I'll also talk about my own experience using a targeted red light therapy device and whether it was worth it. If you're new here, I'm Cam. I test out recovery and wellness tools to figure out what actually works and not just sounds good in theory. I try to cut out the fluff and just give you the stuff that's worth your time. So here's why I tested it. Like a lot of you, I've tried the usual fixes, but so many of them just focus on temporary relief. They work sometimes, but I wanted a solution that was different and that actually got to the root of the problem. My goal wasn't to magically get rid of joint pain. I just wanted to see if I could go back to a place where I wasn't thinking about any of the aches all the time. And that's what led me to a specific targeted red light therapy device. One that was close to what they actually used in all of these research studies I've been looking at, and one that also looked like it could get into those deep-seated issues that maybe other red light therapy tools couldn't. My thought was, if this works, it'll be a complete game changer, and if not, I'll just add it to the things that don't really live up to the hype. So how does red light therapy actually work? Simply put, red and near infrared light are absorbed by your mitochondria. These are the powerhouses inside your cells. This ramps up something called ATP, which is basically cellular energy your body needs to function. With more energy, your cells can now repair damaged tissue faster, and it also helps quiet the inflammatory signals and improves blood flow to that specific area. Now, this is an important distinction that you might not be aware of, and you probably don't hear a lot. When you look at all the successful clinical trials, most of them actually used a laser-based device, not just a simple LED-based device. Here's why. It all comes down to something called irradiance. So put simply, irradiance is the power of light hitting your skin. Lasers can deliver much higher, more targeted doses of energy, getting deeper into those joints where the inflammation and pain actually live. That's why I chose a device that uses a combination of both LEDs and lasers. Now, it took some time, but my mind was really changed when I looked at the actual data. Because as you know, it's not just what you feel all the time, it's also sometimes what the research is able to prove. There's a study I frequently mention on arthritis. Patients who were dealing with serious joint pain, and after constant red light therapy use, their pain scores just didn't drop. They actually dropped in half. Now think about that for a second. For so many people, that's the difference between being dependent on medication and then also finally realizing you can finally walk, move, and feel nimble again. That's when I realized this wasn't just a biohacking gimmick, it was a real tool for long-term healing. So here's what the research says. This isn't just about one-time relief, it's about measurable long-term change. Studies have shown consistent use can significantly reduce discomfort. And that's because it helps with tissue repair, blood flow, and I have another video I'll link in the description on what I specifically did for an ankle sprain. But red light therapy, this time specifically with a laser-based device, is one of the few recovery tools that you can use at home with a lot of the clinical research behind it. So let's talk about what I noticed when I put this specific device to the test. I chose to use this red light therapy device more so for prevention than actually curing any sort of bad injury. See, a lot of times injuries and aches can sometimes sneak up on you because they come slowly. You feel a little bit sore, and then you ignore it. Weeks go by, and then one day becomes unbearable. I didn't want that. I live a fairly active lifestyle, so I tracked my soreness levels specifically in major joints, like my knees, my ankles, my elbows, and my shoulders. Keeping it simple and just rating the pain on a scale of 1 to 10. And then also making sure that I made a mental note on how I felt. Now, the first few sessions are always nice. You get that warm feeling you usually experience with red light therapy hitting your skin. But after several weeks, I started to feel less stiff. So for example, when you wake up sometimes in the morning and all your joints just feel completely locked up, and it might take you maybe half an hour or so to get things going. Using this device, it didn't mean any of the pain was gone, but I felt like it was easier to get up, get going, and not having to warm up as long as it took before. Now, around a month in, the bigger changes do show up. You know, the type of pain that you sometimes almost accept as part of you. Some people even refer to their joint pain as, oh yeah, I just have bad knees. Oh, I have a bad back. No, we don't run. We can't do that. It's like they've completely given up and the pain is now part of their identity. But you don't have to. Instead of feeling that constant nagging ache throughout the day, with red light therapy, it can slowly become a distant memory. Imagine being able to go on longer walks, longer jogs, again without being reminded of your pain every couple of steps. So here are the pros and cons that I noticed. Now, on the positive side, red light therapy devices, I always say, are passive solutions. It's the ultimate set it and forget it tool. It's non-invasive and it's drug-free. There's no side effects or dependency issues you can run into with certain types of pain medications. And then it's also backed by science, and the research is actually growing significantly every year. And I can only imagine what that will look like in the next 5 years or so. Now, on to the downside. It's easy to get lost in the entire ecosystem of red light therapy devices. There are so many out there. Quality red light therapy devices can be a significant investment, especially the ones with higher power ratings, like the ones that were used in the studies. That's why I opted to go with a device that uses both LEDs and lasers. I'll link to it in the description, and I'll also update it if I find any other red light therapy laser devices that I think are worth it. But the results aren't instant. This is for people who are in it for the long haul. So who is this actually for? It's for the person who is always pushing for peak performance, but is also sick of dealing with nagging injuries and very slow healing. Sometimes, who really wants to sit around waiting for months when the technology has improved so much and it's out there for you to use? Secondly, a person who works very long hours, carries a lot of stress, and feels a lot of mental and physical burnout. Why? In many cases, you're straining your body, you're wrecking your posture, you're even creating muscular imbalances without even being aware of it. And then also, this will help you if you're seeking longevity. To you, it's about preventative wellness. You want to stay sharp, you want to stay active, and you want to do all these things for many years without being limited by pain. It doesn't demand any extra effort. It just quietly supports the goals and habits that you already have. So, is red light therapy worth it for joint pain? I would say yes, definitely try it. It's being used in clinical settings, but you can also take it home. Stay consistent, and over several weeks, it can help reduce your pain, help increase your mobility, and also give you the freedom to live life on your own terms again. Now, I'll also link to some of those studies I mentioned earlier, along with a deeper breakdown on the topic on my website. In the meantime, I'd also love to hear from you. Drop your thoughts and comments, and let's have a conversation. And if you want more grounded, research-backed reviews and real-world testing of recovery and wellness tools, make sure you hit the subscribe button, and I'll catch you on the next one.